Hey y'all, thank you for joining into Teal Talk, where we talk everything intersectional from sexual and domestic violence to race theory and culture. Remember to write any questions in the comments as me and my guests will be answering them live next week. Enjoy. So welcome everyone to our Teal Talk. We are so excited to have Kawther here with us. Kawther is a friend, first of all. We worked on some projects together with the Somali community, and Kawther has been nothing but extremely kind and patient with my learning. So I'm so grateful to have you, Kawther, here with us today. And I'll let you go ahead and introduce yourself and explain the work that you're doing around Columbus.
Thank you, and Olivia for having me and inviting me this conversation today. It is really a great opportunity that I am presenting some of my work and what we are doing at the community. And it was great to work with you as well. So, as you said already, my name is Kawther Musa. My last name is Musa. I have a master's of clinical nutrition, and I have a bachelor's of human nutrition. That's my major, but I work at different areas because people don't get work for what they have studied. So right now, I am a HIV Program Coordinator with Heart of Ohio Family Health Center, and I have I used to work with the infant mortality rate earlier this year, and in 2019 2018 I have worked with Celebrate One. I have worked with Somali Community Association. I have worked with Somali Can, and we did great job. And yeah, so right now I provide resources with the HIV people, and still I'm doing same work of like the infant mortality project with Heart of Ohio Family Health Center, because the area that Somalis reside in, we have high rate of infant mortality rate.
Interesting. So can you like give us a little bit of background about like why the infant mortality rates are higher in the community?
Yeah, the infant mortality rate is higher because of there's so many factors that's associated with this. The area that the Somali community reside in, the zip code, like it's not a zip code that the government or the city is providing that much resources. So that's one thing. The other thing is, in general, the Black community, they have high rate of infant mortality rate, so they are part of that community. And also because of the lack of education is another factor that's causing that the Somali community is a part of the problem. So in back home, the Somali community, they used to share the children with their bed, but they had like uh, they didn't had enough home, like enough room. But here in America, when they came, it's still they feel it's the same. So like, well, they have it's still 5 room or 3 room. It's still the mother and the baby is sharing the bed because of the tradition, and that's one thing that we are working on it to prevent it. Yeah.
Super interesting. I think all of the work that you do is so interesting. Um,
Exactly.
so I was curious if you could explain like how you got into this work. What led you to being a community health worker?
Yeah, I what got me into this position is first I was hired when I have started my regular job in here in Columbus. I was hired as an office manager, and I was, connecting the cases, collecting the cases that the community has. I used to put together, and I found out the community there is so many other things that's going on within the community. I learned there is a lot of problems that need to be resolved through my work as office manager. So from there, I decided that to be somebody who can do something like somebody who can help with this community. And that's why I went to Ohio State University and I earned my certification. So to know more about the resources that's available in the city, more about the opportunities existing, so I can be somebody who is there for them. And also I was one of the organizers of Somali Somali independently. I used to raise money for the community so we can celebrate all in one day. And I raised a lot of money in 2018, 2017. I raised a different money like 100,000. I raised at 50,000. So I found out something can go ahead if I try something. So I still am doing that things and I'm still grateful that I'm doing it.
Are you all having that event this year with COVID, or are you having it maybe virtually?
Unfortunately, because of the COVID-19, this year we have canceled the event, but we had a great event last year, 2019, July 1st. And, we got a lot of support from different organizations. We got invited the city officials. We got invited all people who has interested this event. Almost 3,000 people came together that day. It was outside, it wasn't indoor, it was outside. So kids played, people met people that they never met. So it was a great event. And if you go ahead and check the dispatch, you can find that information. And also, I am one of the advisory council member of Franklin County Sheriff's Office.
Oh, perfect.
Yeah,
Awesome.
they have created a advisory council member so the people can, be part of that the sheriff office so they can give like if there's something going on within the community, we can be like a part of, like we can work together better. People when they have a relation and when you have a relation with the different organizations, you know what they have, and like when there is something you can let them know, so we work together.
Gotcha. So there's a specific officer that works for the sheriff's office that does outreach with the Somali community, right?
No, the Franklin County Sheriff's Office, they have created advisory council members. So I'm one of the members of the council.
Gotcha. Okay, interesting. Great. That's so interesting.
Mhm. And also right now I volunteer with Case Western University in Cleveland University. What I do is I do what they call Islamic trauma healing. So like the people who had been in country where there was a war, people who has been infected by car accident or lost their loved ones, like we give trauma healing, we provide like counseling. So that's a project that I have been working with them, and right now that project is ended, and we did also our research and our research has been accepted. So now if you go ahead and try to see about Islamic trauma healing project, you will find that research. The result is out there.
And that's with Case Western. Yeah,
Yes.
that's so
Mm.
awesome. So what are like when we're talking about like trauma and trauma that's specific to your community, like how does that differ from trauma that, non-Somali folks have? Like what are some of the things that they're coming over with and having to address when they get here?
In Somali culture, people don't believe what we call trauma. So in our project, we have started just to educate them about what is called like post-traumatic stress, like all those things. So in our culture, they don't believe if there is existing what we call trauma. But when you ask different things like, have you ever had a car accident? Have you had a like have you lost your loved one? And if they say yes, I lost my loved one, how do you feel? Like they're gonna tell you like that they have the symptoms of trauma. like crying, not feeling well, not sleeping at nighttime, stressed all the time, not energized. They're gonna tell you like all the symptoms. But if you ask like, do you have this? They're gonna say no, I don't have it. So so we don't tell them yes, you have this, but still we try to use different phrase so they don't feel like, oh, you have been you have been like given name by this, because it's kind of a shamed word. Like they don't, culturally we don't, they don't share that information, but they're gonna tell you the symptoms. So but we deal with the symptoms.
So actually naming the events and naming the symptoms instead of coming in with that language. That's so interesting.
Yeah.
That's so interesting. So can you explain like the family structure and what makes the culture different than what we see in mainstream American culture?
The Somali culture and American culture, it's a little bit different. In America, in Somalia, let me say first in Somalia. In Somalia, in Somalia, like when you marry a man, you go with the man, you stay with the man, and then the family of the family of the man is your family, and you respect them 100%. But still you have your other family, but you are more related with your as a woman, I'm talking about as a woman, you are more related to your husband's family, because we believe even the name of the children will go to the father's family. So like when we asking the full name, let us say for me, my name is Kawther Hersi Musa. Hersi is my father's middle name, Musa is my last name. So my name will go my father's name. So if I go and marry a man, my children will go the man I married. They will not take my family name. So considering that the woman goes to her family husband, she stays with them, and also we she, we can like extend what we have, what we call extended family, like the, for example, let us say the husband's father, her father, brothers, sisters, they may stay with you, like live with you, and you may not say anything, and that's normal. But still you can have your other family as well, if there is enough, for example, in terms of financial, if it's okay, you can also bring your family. So it's a little bit different in American system. But when you are in America, you are with your, you are by yourself, and with your, or with your husband. Like people are here in America are very busy, like they don't stay together. Like your sister or your brother, you may not see a month, or even more than that. While in Somalia, you're gonna see every day your brother, your sister, your family members, and everybody. Or they can live with you. If you financially have, if you are financially stable, they can stay with you, so you can provide food and shelter. So it's a little bit different here in America and Somalia when I compare.
So how does that that extended family structure, what does that look like when we are dealing with survivors?
If the husband, brothers and sisters are at home, and has some problems, she may not say it, she might hide it. Like for example, if he is abusing her, for example, let us say financially, or if he's hitting her, or if he's doing something bad, she may not mention it, she may not talk about it, she might deny it, because she's afraid of the husband's family and friends, because they live with her. So that can take years and years. So it's a little bit difficult.
Yeah, definitely. I think about when you and I first started working together, how a survivor would walk through the door of the community center just because like that was just the time that they had to get away. They didn't have a bunch of time to do extended advocacy. We kind of had to figure out what we could get done in an hour or so.
Yes, absolutely. Yeah, absolutely. But here in America, it's open eye. Like right now, they know they have a right, like the man does. Yes, in Africa, in Somalia, I'm not saying women don't have a right, but I feel like because of the culture, because of the what has been existing for many years, you cannot change it by yourself. But here in America, at least there is a system that's existing, and you can share your, for example, say something, but not all. Like for example, if the woman has something going on, for example, let's say like if the man is not providing, because Islamically in Somali culture we believe that the man is the one who is providing the financial support, uh, the family. But the culture has changed here in America, but a lot of women may still wait that support and say he is my husband, and in terms of religiously he has to provide me the food, he has to pay the rent, he has to do everything. And then when they marry, they both agree that the man will do all these things. But after marriage, things change, because the man he gonna say, oh no, I'm not gonna provide you anything. And she may feel guilty, like saying, oh, why I have married this guy who has lied to me.
Yeah, definitely. I definitely want to talk about the marriage structure and how that's different, because when we were working together, that was like a huge barrier in understanding, um, from me not being in the culture. So trying to learn that process was just, it was interesting. And I think as advocates, like, we need to know, what marriage looks like in different cultures, so that we can help survivors get safe in the way that they need. So could you explain a little bit of the difference between like a religious marriage and a legal marriage?
Let me say, religious marriage is like you marry a man, and when you marry that man, only the person from mosque you or somebody who knows how to do this process religiously. He can be your father, he can be your brother, he can be your neighborhood, he can be anybody who know how to do this. You know what I mean? So, so they do that religious thing. It's not something like it's official. It's official in religiously, but they require two people or three people to be there that day for the day of marriage.
Mm-hmm.
So that's one thing, you know. People still do that most of the time, especially Somali community. They do like 80%. They do that type of marriage, but the problem is they don't go to the court and do it legally. You know what I mean? They don't do it officially. And in American marriage, it's different. Legal marriage is different because you have required to go to the court when you want to marry somebody, but they don't have that knowledge. They don't do it. Or if they try, if the woman requires, hey, I want to do the legal marriage, the man, he gonna say, oh, okay, you don't trust me then. You just trust in the system. You don't trust me. If you trust me, just you go with me and let us do this way. And later on in life, it ended up like everything fails. For example, if he is not providing anything, for example, the rent, the food, whatever, if he's not sharing with her even, she don't know what to do, because it's not something registered, it's not something that has a data, it's not something that legally happening. It's just between them and family members, and that's okay religiously. I'm not saying that's not good, but still they don't have the knowledge that they can do both. For example, go to mosque you and do the religious paperwork, and then go to the court and do the legal one officially. They don't know that information. So that's one thing that I feel like the Somali society, they are not aware about it, and that's one thing that's like killing the Somali community, the Somali women, because many women, There's so many things going on every day. Right now I see like a pregnant woman who is complaining from her husband every day. For example, she don't know what to do. She's the one who is providing the food and everything in the family, and he's not doing anything because he believes like nobody knows him, because she's the only one who knows. The system cannot find him. But the good things is that, for example, the resources right now, like me, I advocate for them and I give them the resource so they can get way out.
What do you think are the most useful resources for your community? Like, what are people you accessing the most?
For example, if they have something going on in their family, it is it's very rare. They don't share anything. Like they're not gonna tell anything because they are afraid. They don't want to say. So what happens is whenever you ask a question, she's gonna tell you, I was going through this for the past 4 years, for the past 5 years. So right now, I feel like when they see like caseworkers, somebody who can help them, when they see somebody who can advocate for them, when they see somebody they can trust them, they're gonna share with them what they feel. So the resources that right now they use is like, it's like in general they go to family and job services, they go to Somali community office, they come to our office because we provide them the resources that they need. We help them with transportation. And that's another challenge in existing in our community, because some of them they don't speak, most of them they don't speak English, and then they cannot pass the test. So they have that problem always.
Language, I remember, is just such a huge barrier, and was for us in,
Mm-hmm.
being able to serve people. A lot of the times we would have to have you interpret, which isn't, best practice at all.
Mm-hmm.
So I definitely know that, language,
Mm-hmm.
access to language is a huge barrier too.
Mm-hmm. Mm-hmm. And the other thing is like, uh, when it comes to, they don't have like, when they meet somebody today, they are not sharing with everything. But if you build the relationship from the start, it is good thing. Like they're gonna tell you all their needs, so you can help with them. So yes, and transportation and language, but and language is, those two things is like is a great role. Like it's a huge.
Definitely. Yeah. And I heard you say too that trust, um, finding like an advocate or someone that you can trust that can be patient, um, with you. I feel like a lot of the times advocates just like they want the information the very first day, so that they can, do what they think is right. But a lot of communities don't trust systems. So, it's not easy to go in somewhere and give the full story when, you know, historically you don't have a good relationship, with systems, doing what they say that they're going to do and actually helping.
Absolutely, yes. Yeah, it takes time. Like it may need more than one meeting.
So I'm interested if you have any, knowledge or thoughts about what survivors are doing, in Columbus with, um, the list of abusers that's going around.
The survivors, most of the time they ended up like just to stay with the life they are in, because they don't have a supportive system, because of the challenges existing, like as we said, the language barrier. So they stay with their problems. But thanks God, right now we have a lot of people graduated from Ohio State and they are social workers, and they're trying to help the community, to give back the community. um, and that's another thing that's helping us.
Definitely. I appreciate that.
Mhm.
So, what would you say like some of the biggest gifts of your community are? What are like the positives and the things that you're proud of?
The positive thing is the community right now. They immigrated to America since 1990s. So I feel like they have a home in America. They feel like they are in their home, and they are not going to anywhere. They want to stay here. They want to, be part of the community. They want to learn new things there. So that's one thing I'm proud about it. And yeah, so, and always I'm great about the Columbus organizations, non-profit organizations that is standing with the survivors who has a problem. So that's one thing I am happy about it.
Definitely. I don't know if we mentioned this, but Columbus has the second largest Somali population in the country.
Mm-hmm.
And yeah, we're so grateful to be able to get this information from you. I think this conversation is so helpful for people. I think sometimes they don't even know where to start. So getting more information about what the culture and the community looks like gives people a place to start to
Yeah, absolutely. Yeah,
begin
absolutely.
the
Yeah, absolutely.
outreach. Hmm.
Mhm. And also, I wanted to mention one thing about just a scenario. For example, I have seen like uh, a mother who is 25 years old and she has like 9 children, and she don't speak the language and she don't have a car, and you know the husband as well, he don't have a car, they don't have a stable job. And you know I believe kids are blessing, but I also believe family planning is another good thing that can help you, like when you are new in a country and you have like 9 or 10 children. It's gonna impact your life. It's gonna increase, like, I don't want to say like kids are not good, but at least they need also education, like uh the importance of like birth control, like sometimes, because the body tires if you keep giving birth all the time. So I feel like they also might need that education. And yeah, so I feel like we're missing that part as well.
Yeah, thanks for adding that in. I think specific cases, like talking about actual survivor cases that we've seen, would be super helpful. Um,
Mm-hmm.
so if there's any more that you want to highlight, like I said, I remember just like getting calls, and you know, language really was like such a huge barrier. I did want to touch back on the marriage part of the conversation. Um, just because when a survivor would come in and I would say, "Are you married?" and they would say yes, it was that religious marriage, not a traditional legal marriage that we have here in the United States. So that just created a lot of confusion around you fill out protection orders differently when you're legally married versus not. So I just think that's super interesting.
Abs- yeah, yeah, yeah. And also the man, he most likely Somali community, the men are truck drivers right now. So the man, he can make like a lot of money, and he's the only one who has, is under his name everything. Like she don't share with him anything because they are not married legally. He may has a business, he may has like home health care. Most likely Somali community, the things they do is like they open home health care, they open daycare, like childcare basis. They are truck drivers. So the woman, she don't share anything with that because she believes like she thinks like, okay, that's for him only. She don't know if they are married, they can share everything. You know what I mean? Like everything they share if they
Yeah,
married legally, but she don't know that. So
right.
the man is not providing anything, and he do good thing. He do have good money. He has good job, and that's one
So,
thing. Yes, yeah. That's another
So
confusion.
I heard you say education around like healthy sexuality, around birth control and rights with, you know, your body and being able to, you know, control the children that you have, and then financial education. I know that that is, you know, even things as basic as like what your rights are, I think is so helpful.
Mhm.
And letting folks know, because when language is a barrier, it's hard to get real information, right? You're kind of at the will of your partner. If you know they have that connection to the outside world, they can kind of tell you whatever they want to tell you. um, so
Yeah,
I think education absolutely for the community is a huge asset. Totally agree.
absolutely, yes. That's one thing. If this community got it, that's one thing. Like a lot of things could be resolved.
Definitely. I appreciate you and all of your knowledge and patience.
Mm-hmm.
Um, was there anything else that you wanted to add that you want advocates to know when they are, you know, trying to increase their outreach?
Yeah, there is also we have there's housing problems. I know all the community has housing problem, but I feel like the Somali community they struggling with the housing, with the landlords because they don't speak the language. So the landlords they keep sending notice and they sign without reading it. So I feel like there is also that problem. So they need advocates in that area as well. Mm.
Interesting. Any other problems that you know you want to highlight?
Other problems is like when they knew they don't get somewhere they can learn like how to drive, because I feel like if they can drive, a lot of survivors they can stand on their feet, like having a resources like how to learn how to drive a car. Those resources are also helpful.
That's super awesome feedback. I love that.
Mhm.
So again, like that basic education that, you know, I feel like folks take for granted, they don't even consider that not everyone
Mhm.
has that. So thank you so much.
You're welcome.
I just enjoy talking to you so much, Kawther.
Thank you, Olivia, for having me. Please feel free to ask me or send me anything if you think like we can always share and can discuss more about this, because this topic is really interesting, and most people they don't talk about it because of the culture, because of the religious beliefs. But right now I feel like having like this discussion is some one is a week, one is a month, or every other 2 months. I think it will be more helpful because many people will learn about it. Yeah, so
Sure,
thank you so much for having me and bringing this topic in the on the table.
definitely. So I like to close every recording with a rapid fire. So I'm going to ask you a question and you have to answer with the first thing that comes to your mind, okay?
Okay, I'm
And
ready.
it's supposed to be fun, so don't don't put too much thought into it. All right. So
Okay.
this is called the Teal Talk. So I have to know, what is your favorite shade of blue?
My favorite shape of blue, earth.
All right. What inspires you?
Walking.
Nice. If we eradicated sexual violence tomorrow and you weren't doing, you know, community work, what job would you have?
Get the contact information of that person.
If you had a theme song, what would it be?
Let me say Beyonce.
Perfect answer. Um, the first place that you want to travel or the first activity that you want to do after COVID?
Got Florida.
Nice. What are you listening to any podcasts right now? What's your favorite podcast if you are?
I don't do that much. right now.
That's okay. What's the best book you've ever read?
The best book I will tell you the best book of the year. I remember the one that Michael Obama wrote. The name of the book is Becoming Me.
Ah, yes, yes, love it. What's your favorite way to exercise?
Walking.
Walking. All right. Well, we're almost done. What is your favorite Black-owned business to support in Ohio?
Global Mall.
What's the name of the restaurant that I'm obsessed with? Hoyo's Kitchen.
Hoyo's Kitchen, yay!
Yes. I'm gonna enter mine in there too. And where can folks find you?
They can find me on Facebook.
Okay. All right. So we will link the community event that we were talking about, definitely, and we'll link your Facebook if you're cool with that.
Mm-hmm.
And if folks have questions, they can put them in the comments, and then you and I will be addressing those. I feel like we just touched the surface of all of the content that we could get into. So we probably will be doing a part 2.
I hope so. Absolutely.
Well, thank you so much, Kawther. We appreciate you, and we will talk to you soon. Have a good night.
Thank you for hosting this. Have a good one. Bye-bye.
Remember to put any questions that you all have would like answered by me and my co-host in the questions box, and we'll talk to y'all next week. Thanks, y'all.